What's up, you guys? It's my boy Miguel giving you your daily dose of radiation, and today's protocol is: how often is A.L.A.R.A broken at the hospital? So this is kind of a touchy subject because in school they're like A.L.A.R.A this, A.L.A.R.A that. So this is my experience as a student. You'll mainly see from what I don't do fluoro. Well, I do fluoro, but not like I do X-rays, graveyard, so night shift. So I'm not doing constant fluoro exams. So I don't know if it's changed. But sometimes I've heard in surgery, mainly when I was a student, you would see sometimes the A.L.A.R.A being broken amongst Texans, mainly because of doctors. Because naturally, as we learn in school, there's a set amount of fluoro. It's with the fluoro mainly. Fluoro time that can be given per patient. Because after a while, it starts beeping to remind you, yo, too much dose on this man or on this lady. And then, it's our job to remind the docs, yo, you're pushing the limit of how much radiation can give. And I've seen it's kind of an iffy bound. I remember our students, some of the techs would be like, okay, so the most anyone has ever pushed it was to X amount. And then I was like, yo, it's too much, I'm gonna stop. But other times, it's kind of a gray field, because if there's so close to being done, and then you're fighting to stop it, so it's kind of like risk versus reward. Because imagine if you just stop doing radiation to get the pictures and stuff, and then maybe the physician wasn't able to completely finish what he was doing, and then he just ends up just patching the patient up, and then later on they have to come back to fix it and get more radiation, you see. So for the most part, from what I've seen from when I was a student, from all the veteran techs, it's kind of use your better judgment, and everyone has their own threshold of what we hold accountable of, okay, this is how much, because sometimes how many times in the X-ray you've had to shoot a pregnant lady and make waiver signs because their femur is broken, or something is major is broken, and then you feel bad doing it. But one of the doctors explained to me, he's like, okay, you got to think about it like this, Miguel. He's like, how badly do we need those pictures and the risk versus reward? He's like, imagine you don't X-ray that lady, let's say it's her hip, and then something happens and then she dies, right? Because you didn't want to expose her to fix her problem, to get her help. Well, now you have two deaths. When yes, they could have done that. Pictures could have have slightly radiation to the little one, and now you could have saved both of the lives. And I was like, I guess. So I wouldn't call that a breaking A.L.A.R.A. That's kind of your best judgment on that. Me, who do just regular X-ray cassettes day in and day out, if I shoot it and I gotta shoot it more than 3 times, I'm gonna stop and I'm gonna ask my partner to shoot it, or give your better judgment. Because after 3 shots of the same thing, I'll be like, yo, I feel bad. And even if I was a patient, I think about the patient and be like, yo, does this man know what he's doing? So it's kind of, you wing it there. Because sometimes the positioning would be good. It's just how crispy the picture will show. Is it overdosed, underdosed? The exposure number, is it good? Tape deal that will, throw variables if you have to shoot it again or not. So that is something that A.L.A.R.A has to do. But even though when we learned as a student the different levels of radiation and how cassette radiation, just regular X-rays, is like really low compared to like, you know, CAT scans and other stuff. So you don't feel as bad shooting the patient, you know, but still, it's still, you know, radiation nonetheless. So, but yeah, that's mainly where I see the A.L.A.R.A kind of being pushed to the limits. It's mainly in surgery because that's where you have higher dose of radiation. And mainly because of that, I chose not to pursue. I wanted to do surgery, but I chose to not do that because I saw amongst there and other hospitals that they push the fluoro time a lot, or they'll be overworking some of the techs. So, I mean, if you're out there doing it, you know, thank you for your service, but it's not for me. I liked it. It's nice and cold, so I didn't sweat, but at least not here locally where I'm from would I pursue the surgery. Yeah, it's been your boy Miguel. See you on the next one.